Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Hey guys, thanks for being listeners of the show. Go to dentalimplantpractices.com and find all of our resources. Also find us on Facebook, Dental Implant Practices page on Facebook, and go to iTunes and leave me a review on iTunes so we can help spread the message. Thanks. Welcome back to another episode of the Dental Implant Practices podcast. I'm your host, Philip Gordon, and today it's a huge honor for me to introduce Carrie Weber from the Jameson Management Group. Carrie, thanks for being on the show.
Thanks, Dr. Gordon. I'm so happy to be here today.
Carrie, you are the Chief Communications Officer and co-owner of the Jameson Management Marketing Program. Tell me a little bit about yourself and the background of the business and your role within that company. Sure,
happy to. Well, Jameson is, as you said, a comprehensive management and marketing firm we have been a founded company for well over 27 years now, providing comprehensive business and hygiene coaching services to dentists and teams across the United States and beyond. And for the past decade, we've also provided full service marketing. Our mission is to help dentists and teams become more productive, more profitable, and ultimately more fulfilled in their practicing lives. Our company was founded by my parents, Dr. John Jameson and his wife, Kathy. My father practiced dentistry for 30 years. He's now a retired dentist, enjoying his retirement immensely. So I always like to tease that I was truly raised on and in dentistry my whole life. And my husband, Jess, and I have worked in the company for almost 18 years now. And for the last going on 5 years, have been the owners leading the company forward in the past 5 years. So we get to see a lot of dentists and teams across the United States and have an amazing team of advisors, both in the marketing, management, and hygiene realm that are hygienists and clinical assistants and dentists and office managers, clinical assistants, people that really have a love for dentistry and want to see dentists pursuing and achieving their ideal practice visions. And that's what we are all about here at Jameson.
That's great. I really like that story. My father was a dentist also. And so I grew up in dentistry, and I chose the path of actually being a dentist myself. But at times I wonder if I should have just went into managing and consulting, because it sounds a little less stressful at times.
I know.
Yeah.
Well, it's funny because the joke is, for a lot of our team that's been with us for a long time, I swore I was never going to be in dentistry because I lived and breathed it. Having a mother that's a consultant and a father that's a dentist, you can imagine the dinner table was pretty heavy on the topic of dentistry at all times growing up. And I spent a lot of time in that dental office doing a lot of different things. And I think I just was meant to continue on the legacy and tradition that my parents have loved so much over the years.
Well, it gives you good perspective, and it gives you good insight, and probably a lot of credibility to know that what you're talking about has some validity, and you've seen a lot of changes over the years, and so that I'm sure it's been a great thing for you. What's your specific role within the company? I mean, what do you do on a day-to-day or week-to-week basis that that you feel passionate about?
Oh, wow. Well, I wear a lot of hats on the team. I have a real heart for marketing and for customer service. So I work with the marketing division on a frequent basis, making sure that we're providing great services for our clients. And then I also get to educate across the United States in lectures on case presentation, customer service, marketing, and helping dentists and teams really refine their skills in those areas, while also working on the development of our business and helping to make sure our advisors that are out in the field working with dentists and dental practices have the tools that they need to help those doctors be successful and their teams as well. So there's a lot of development that always is taking place, and then a lot of education opportunities, and then leading our team forward for the years to come so that we stay relevant and make sure that we are providing the most relevant and timely education and coaching opportunities for those that choose to work with us.
This podcast obviously is about dentistry, but more important or more specific than that, I guess, is implant dentistry. So let's say someone like myself, has been graduated 10 years and they're out and they want to do a lot of implant dentistry, and they go take every course of the MISH and the Maxi course and, all the CE. There's still a chief component of that may be missing, whether it be management skills or leadership skills or communication skills. Where do you see someone like yourself helping either a practice or a group practice or a solo dentist or a practitioner help kind of grow in those areas? And where do you see the most potential for that? Because obviously, you do some presentations on case acceptance and leadership and the staff role in that. Where can we start? I know that's just kind of throwing it all out there. Where do you like to start? Kind of walk me through, give me your go-to kind of talk on how to get better at that, how to get more patients to accept that dentistry that we have been trained to do.
Right. Well, it's a loaded question, Dr. Gordon, as I'm sure you can. I'm sure you can appreciate. But at Jamison, we believe there are integral systems within a practice, business systems, that if they are all working cohesively together and effectively together, it helps you be more successful as a business. And I'm not talking about your hard skills as a clinician. I'm talking about those business systems and skills that help you run your practice more effectively, more productively, more profitably. One of those systems is your case presentation skills and getting treatment acceptance. And it can be a difficult one for doctors and teams to become successful at, or that's often a hot topic, that's for sure, on how can I help more of my patients say yes to the treatment we're presenting. And so what I always like to talk about with those that choose to listen is that when you are talking about case presentation, you are entering in a realm that's not just the hard skills you have as a clinician, be it, that your ability to effectively diagnose and effectively treat the needs of your patients. We are entering into what everybody dreads, and that's the soft skills of being a leader and a communicator, and really that emotional intelligence piece that can help you and your team be more successful in getting patients to yes. And you hit the nail right on the head when you were saying communication skills and your problem solving skills and your ability to work as a team together for the benefit of the patient. So we walk through those processes together in helping doctors and teams become more comfortable in understanding and practicing and executing a more effective process in case presentation. We believe there's 6 steps that you would be walking a patient through for effective case presentation. And a lot of them, you'll hear that relationship communication piece within it. It's build the relationship, establishing the need for the treatment, educating and motivating the patient, asking for the commitment, making financial arrangements, because as we know, cost is such a determining factor for patients and how or when or if they're going to accept treatment. And then, of course, scheduling that appointment. So those are all loaded steps, obviously, within the umbrella of case presentation. But what I think is important for us as dental professionals to understand is what I believe, and I learned this from a dear friend and mentor of mine over the years, is that if someone is not accepting what I'm presenting, or they don't return, or they're thinking about it, I have not met the mark for that patient in trust, need, hurry, or value. They're saying no, or they're delaying treatment because we aren't meeting the mark in building in one or more of those 4 areas. They have no trust. They don't trust me. They don't believe me. They have no need. They see no perceived need for the treatment, or they aren't in a hurry for it, or they don't see any value for it. And it could be one or more of those areas. But I think if we all looked back at cases that we present on and we think, oh, yes, this patient is moving forward, and then we wonder why they're not on the schedule, there's a really good chance if we look back, we dropped the ball in 1 or 4 of those areas.
So
does that make sense?
Oh yeah, absolutely. No, I completely agree. So you like to look at it as, okay, there's a method behind this. There's 6 steps that have to go on for every good case presentation. Yeah. And then in that presentation with those 6 steps, we need to meet the 4 needs. And if we go through these 6 steps and we meet these 4 needs, our case acceptance is going to go up.
Yeah, and and here's the key is that it's not the sole responsibility of one person alone on a team. The total team approach is the best possible way because each member of your team can make or break a relationship with the patient, and a patient can determine whether or not they're going to move forward based upon their experience with anyone that they cross paths with in your practice. So that total team approach is really important because we could walk through the various stages of a patient's relationship with you and could determine when, where, or how they could accept treatment. We often feel like if they don't say yes immediately, then we just, we'll see them in 6 months and maybe we'll talk to them then. And we aren't persistent and consistent in how we communicate and build value for the dentistry that we're providing. And, I think we all understand that we're often behind the 8 ball as dental practitioners, that patients really would rather spend their money somewhere else, right? So for us, it's important that we value the treatment that we as a team are a part of providing, that we work to build that value with the patients, and that we're working to build relationships of trust with those patients. And that comes down to how we communicate and listen to their needs and wants and their dental goals. And the more that we talk at a person and tell them what they need, until we hit the button on what it is that they want and need and base it upon their wants and needs, we're not going to get very far in the conversation. So it's a total team approach that's going to make all the difference.
Yeah. It doesn't have to be all the doctor, or it doesn't have to be all one treatment coordinator. There's multiple touches in the patient experience, and they're kind of judging us from the moment they walk in. So it's good in the fact that it's up to everybody, but it's also nobody can really hide at the same point. You can't, it can't just be one person that can blow it for an office. So you have to evaluate your team and yourself, and everybody has to be on the same page.
And that's a common point of frustration for a lot of doctors or team leaders, is they feel like they've got the patient in a conversation and that patient's telling them, yes, I'll move forward, and then they see it or hear it fall apart along the way and nothing gets scheduled, and they wonder why. They told me they were going to do it. What happened? And it's really being more strategic and being more comfortable and confident as you pass the baton from teammate to teammate, that everyone is ready and able to answer questions, to listen to concerns, and to get that patient to where they need to be in their treatment and their care.
Now, can we go through your 6 steps just real quickly? I know we don't have time to expand 20 minutes on each one, but can we go through the 6 steps and you just do maybe a line or 2 on each of those? You said there's 6 steps for a good treatment case presentation. And this can be someone coming out of hygiene or a new patient. But let's just say it's a new patient and we're talking comprehensive care. You said there's 6 key steps. How would you give a 1 or 2 line recommendation on how to do each of those?
Okay, so think of it as a map that you're taking them step by step through becoming a patient of yours, and that they're coming to you with goals and needs of their own. And we want to make sure that we not only build the value and build the relationship, but we also help them get the treatment that they want and or need. So that build the relationship is the very beginning. And, the power of communication really comes into play here, that, the importance of customer service and how you answer the telephone, and those pieces of the puzzle. I mean, American Express just released a report a couple of years ago saying that somewhere around 77% of customers determine whether or not they're going to do business with a business based upon the customer service experience. And it's important to embrace that as a dental practice, that the way we care for the patient from the moment they we answer the telephone and all the way through makes a difference, that we are as a team providing them with great information. Let's say the patient calls in and they schedule an appointment. What are we doing from that point forward to continue to build the value of that appointment? Are we staying in contact? Are we sending them high quality materials and information? Are they accessing great information on our website? Is it relevant and timely? Your website is a window and almost a brand ambassador for your practice, and it's setting the stage. So if you're wanting to do comprehensive restorative and aesthetic work, but your website is 7, 8, 9 years old, and it has so much to be improved upon, just remember that your patient's perception of you and the experience they're going to have and what they expect when you present treatment to them is already being built before they even walk in the door. So we want to be building that relationship and setting the stage for their experience before they even walk in. And do as Michael Levine in his great book, Broken Windows, Broken Business, says, and that's, walk through your facility and see if you've got what he calls broken windows, meaning are there stains on the carpet? Is there outdated, materials in the reception area? Do you need to do it? Do your walls need to be painted? Is there dust everywhere? Things that you may overlook every day. People are sitting in your dental chair looking around and establishing a perception of the quality of your care based upon what they can see in that moment. So to make sure that everything that you provide a new patient and that they see and experience reflects the kind of dentistry that you want to provide. Make sure that you're mirroring what you're wanting to be providing in your care and your vision. And that your team, daily huddles are really important, that everyone understands who's on first and what's happening, and that we are prepped and ready for those new patients to come in, and we are greeting them in an exceptional fashion, and we are wowing them from the moment they walk in the door. So, the building the relationship, when I walk in as a new patient, you are greeting me with a smile and by name and by a handshake, and you are grateful that I'm there, and that you are setting a tone of professionalism that is really going to take me by surprise. Then when you go into the establishing of the need, I want, your team and your doctor to be walking that patient through that experience, opening them up with questions and asking specific questions. And I want every conversation to be in a comfortable setting, that you're not not talking over a patient when they're laying down in the dental chair, because it's such an anxiety-ridden space. I want it eye to eye and knee to knee, and you're having conversations that are going to open that patient up to conversation that helps to build that trust and value. 2 of our favorite questions that we asked in an initial interview for a new patient is, what are your goals for your mouth, your teeth, and your smile? And what are your expectations of me as your care provider? And sometimes patients can't answer that question. Those are surprising questions to be asked, but they're door openers that make that patient start to think about, what is it that how do I want to be taken care of? And it gives them an opportunity to share with you what their goals are and what they want. And the most important key is in those moments when you're asking questions like that, whatever your questions might be in that initial interview, is to listen and let them tell you and give them time. I was just doing a study recently, reading through some information on communication in healthcare, and it said that most doctors will interrupt a patient within the first 18 seconds of the patient describing what is wrong with them. So that's not much time for a patient to be able to tell me what's going on, what they want, what the problem might be if they have one, what their concerns are, or what their goals are for their dental care. So establishing the need and finding out what the patient wants, because one of our clients has said, when we stop telling them what they needed and start asking them what they wanted, that changes the whole trajectory of the conversation. Now I'm only in the second one.
Yeah, I know. Yeah, keep going. You're doing great. I think you're all making great points. Those are exactly true. That's why I'm not jumping in. I'm trying to be quiet and listen and trying to practice as probably because most doctors are males and they're not good listeners. So that's probably why they interrupt. We always try to fix things.
It's easily ignored. It's an ignorable skill. That, it's uncomfortable. If it doesn't come naturally to you, it can be very uncomfortable at first, and you feel very awkward. And we often, I think it's our human nature to just, if there's silence, we just want to jump in and fill the silence. You want to fill the void, right? But listening, truly, and engaging in active listening, is where we give the other person all the space they need to communicate and feel heard. And feeding back to them what they've said, so that message sent is message received, and we really understand, what their needs are. And that, that's in a nutshell. My goodness, that's just a very blanketed overview of what that looks like and how doctors and teams implement those tools with patients as they're coming in and they're starting to build that relationship and establish the need. But
how are we educating then?
Well, so when you move on into the education and motivation piece, we're talking about the true case presentation itself, right? We want to be educating the patient on what's going on in their mouths, and we want to be motivating them so that we're building that sense of urgency, that the no hurry piece that I talked about earlier, and the no perceived need piece. American Dental Association, they actually do a study every few years. They're probably due to release a new one soon, where they are, surveying the population on reasons why they either delay treatment or forego treatment, or that they're saying no. And every single time the results come back, the cost and no perceived need are always in the top 2 or 3. So it's important that we are doing everything that we can to educate them on what's going on and helping to motivate them to see the need of the dentistry that we're diagnosing, and then activating them. So it's educating, motivating, and activating, getting them to the point where they're not only just saying yes to treatment, but they're also we're finding a way, making the right appropriate financial arrangements for them, and then helping them move forward by actually scheduling an appointment. Treatment coordinator is a powerful role. If you don't have a treatment coordinator and you're looking to do more extensive cases, it's an important position in your practice to consider. This is someone that's not only comfortable with clinical knowledge of the dentistry that doctors would be presenting, but they're also confident and they're comfortable in quoting fees, and have a confidence in the doctor's ability and in the dentistry that's being presented. They're also, as we mentioned earlier, that have the ability to be a good listener and are willing and able to take conversations to their finality when it comes to taking the baton after a doctor's presented the diagnosed treatment and helping patients find a way to make it feasible for them. So it's certainly, if those listening to the podcast don't have a treatment coordinator in your practice right now, and if you really do have a goal and a vision in your practice that you want to be providing more comprehensive restorative care, and you find case acceptance being a roadblock, putting this team member into the right position and place in your practice could prove to be very beneficial for you. So that's a big one. And then we're really big on pushing the value of time and space for these kinds of conversations. When you're looking at presenting cases in the thousands of dollars, that can overwhelm a patient on a lot of levels. We are talking about really intimate zones of a person's body, their mouth, and their finances. So to underestimate by flat out assumption, how a patient's going to react to those conversations is dangerous. And so we like to recommend having a private consultation space in your practice so that you're having these very intimate conversations somewhere where the patient feels comfortable, where the private conversations need to be for a variety of reasons, and where they can think through and talk through what they need to do to accomplish the care that you are recommending to them. They can get really what psychologists call emotionally flooded in these conversations. I live in dentistry. I also have a second business where I partner with a dentist, and she is my dentist, and I still get emotionally flooded when she diagnoses needed treatment on me. Everybody has their reasons, and so for us to honor and respect that our patients need that kind of space, plus it helps you really work through the financial arrangements or whatever you need to do to make it happen for them. So think about that too. If you don't have a private consultation room, that's a big one to help your patients just have that space and time with you and your team to walk through diagnosed treatment and how to make it a reality for them.
Yeah, I would say getting rid of your office or that extra bathroom and turning it into a consultation room would more than justify it. Or even if you had to sacrifice a treatment op. If you're selling that kind of dentistry out of there and you've got the right team member in there who can do that, the extra value of a treatment coordinator and a consult room, cannot be understated. And I think once you commit to those steps and you're presenting the treatment, you're going to be way ahead, because you can't do that out of the operatory. You can't do that out of the at the front desk. You can't have your hygienist presenting this. I mean, it's got to be someone. It's got to be the right person, and it's got to be the right place, and you got to have that comfort feel. And like you said, those are all important things.
Yeah, I mean, listeners could probably be saying, "Oh, well, yeah, okay, so give me a room, and like all of a sudden I'm gonna be getting 100% case acceptance." Well, no, but it's a piece to the puzzle. Everything builds upon itself, and I think when you ask audiences, could you probably sit down as a team and determine where financially and like in a fee set you hit a roadblock with patients being able to accept treatment, when they're sitting in the dental chair. Most of them nod their heads and can think in their minds. They've got a number in their head. And so what you've got to understand is that dental chair is an emotional space on its own. So not only are you asking me in a place where I could typically be anxious as a patient, you're telling me all of this dentistry that I need to have done, and then you're wanting to quote me a substantial fee. And at some point my mind's going to close off, and I can't hear a word you're saying. And so that's where this kind of space, as you said, Dr. Gordon, that it's comfortable, that it's supportive, that you have the opportunity to be able to, you have a great screen up where you can show visual aids. And let me tell you, if you're not using intraoral cameras, I mean, just to stay in this conversation, the visual aids of photography can make such a difference in patient understanding of the dentistry they need. To see for themselves what's going on in their mouths can offset so much doubt and can really provide that sense of understanding that a patient would need. There's research that says that upwards of 65% of our population are visual learners. So tell me, and I might understand, but show me, and it can help me decipher for myself what's going on. It just takes the level of understanding to a whole new level. So not only to show me what's going on, but also show me similar cases like mine before and afters are so powerful in case presentation. So if you haven't started an archive of library of photography of before and afters of of cases that you're doing, doctors, that can be a powerful, powerful tool in your case presentation, because I can see the dentistry that you do, and I can see a similar case to mine and what it might look like for me. So remember, these are really key tools for case acceptance, for patient understanding, education, and motivation. And this goes for hygienists too. Patients that maybe have diagnosed treatment that they haven't moved forward with. When they're in your chair, hygienist, we want to see 40 to 60% of the doctor's schedule coming out of hygiene. So if you're not taking photography and you're not using that intraoral camera and helping to educate the patients from your space and supporting that diagnosed treatment, that's important to remember as well. We all play a role in helping get our patients healthy, and that camera can be a very motivating and powerful tool to do that. So that's a big one when it comes to building that value of the dentistry that you're diagnosing and presenting.
Great. So your next, I think you had asked for commitment. Tell me about that.
That's right. So asking for commitment. Let's say you're, Dr. Gordon, you've got a patient in your office, and you've presented the treatment, and that's where you're comfortable, right? That is where we typically, I as a clinician, I showing you what's going on in your mouth and diagnosing the treatment. That's all very comfortable. But then when it comes to moving the conversation to the next step, have some practice as a team on your verbal skills. My father, if you ask him today what the difference maker it was for him in his case acceptance, it was the mastery of verbal skills for he and his team. And they would walk themselves through the scenarios and kind of create broad scripts, so to speak, that they would practice. So that wouldn't be necessarily that they would say these verbatim, but they would get comfortable in these conversations by practicing on each other. And so when they found themselves face to face with the patients, they felt more comfortable with those conversations and asking the questions they needed to ask. So an effective close, so to speak, would be, I presented the treatment to the patient, and it's time to move forward and talk about the fee and talk about how to make this a reality for them. So I need to ask questions similar to this. And this is, however you doctors would want to ask these questions. These are just samples that we find work really well. Questions like, do you see any reason why we shouldn't go ahead and schedule your first appointment? Does this treatment plan work for you? Do you need more information, or have I told you enough to make your decision? Is this the type of dental care you would like to receive? And we're putting it back into the core of the patient, right? So, is this the type of dental care you'd like to receive? Yes. Great. So do you see any reason why we shouldn't go ahead and schedule your first appointment? Well, how much is this going to cost? I mean, this looks like it's going to be a lot. So I kind of wonder if I can even afford it. So it's not necessarily the dentistry that you're concerned about it, but it's your ability to afford the care and make it a reality for you. Would that be a fair assessment? Well, yes. So here's another great question. It would be, so tell me, is it the total fee that you're concerned about, or your ability to fit it into your family's monthly budget, or something of that nature? So tell me what the concern is. Is it the fee itself, or just being able to afford to pay for it in any way, shape, or form, so that we can find out what might be potential options for them in our toolbox of financial resources to help it be a reality. So if we were able to find a way to help you ensure that you could get this kind of care, but also fit it in your budget comfortably, would that be of interest to you? Yes. Okay, great. So before we move on to the finances, I just want to make sure that you don't have any other clinical questions for me, because we want to make sure that all clinical questions are answered as clearly and specifically as we can while the doctor's in the room before he or she passes the patient over to treatment coordinator, financial coordinator, whomever may be taking care of the fee and scheduling of the appointment. So these are the things that doctors need to get more comfortable with, is ensuring that all of the information that the patient needs has been provided, that the patient understands the treatment that the doctor's presenting. Another stunning statistic in the healthcare world, not just in dentistry, but in healthcare, is that I've learned recently is 60% of the time patients misunderstand the doctor's directions. So if I'm emotionally flooded and you are presenting extensive treatment to me and none of that sinks in, what are the odds I'm going to say yes to that treatment? So we need to make sure we're taking our time and we're asking a lot of questions along the way to give the patient opportunities to ask questions that they may need to ask to feel comfortable and to truly understand what their next steps are. So that's in the asking for commitment. We want to be selecting a close, so to speak, so that we make sure that the patient's ready to move forward into the steps of making those financial arrangements to get the dentistry taken care of, which moves us into the financial arrangements. And this is where the treatment coordinator is such a powerful role, as I spoke to earlier, that the person that's taking care of the financial arrangements really has to be comfortable with quoting fees. They have to truly value the dentistry that the doctor provides and that practice provides. I think we sometimes get in our own way because money is can be such an uncomfortable area to be in conversation about. But I feel like if we put upon ourselves the trust, the urgency, the need, the value questions, do we trust our doctor? Do we see the need and the urgency for this care for this patient? Do we see the value of the dentistry that we provide as a team? If we can say yes, 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 then I feel like that sets us up to be more comfortable and confident in the conversations about money. And this is sometimes where we get in our own way. So we want to make sure that all those clinical questions are answered before any discussion of money takes place, because we want to make sure that the patient hears and understands the diagnosed treatment, right? And then we want to be quoting the total fee so that the patient can understand the total responsibility, and then work with the patient on how they would like to take care of that financial responsibility, letting them lead this conversation with us. Have all the necessary information and material at your fingertips so that you don't sever the connection with the patient. So let's say the patient needs and is interested in patient financing to take care of their dentistry. Well, if I haven't done my due diligence prior to the presentation and I'm running all over the place trying to get the paperwork and find all the information, I keep severing that very intimate conversation. And have you ever been in the middle of a story and you were really connected with a person and someone interrupts or takes the person away from you for a moment, and then you try to get that momentum back once their attention is back to you and it's just lost? Have you ever had that happen?
Yeah, I mean, you just you lose the connection is what happens, and or they lose trust in your ability to know what you're doing.
Yes, and we want them to feel and know that they're important to us and that they have our full undivided attention. And so to be prepared for those financial conversations as best as you possibly can be is important. And be prepared to spend as much time as necessary to get the agreement. I think sometimes we get rushed, we get distracted, we get overwhelmed. So if we're not appropriately planning that sacred time, we have this amazing client. His name's Dr. Mark Hyman, and he speaks nationwide on his team's extraordinary success in case presentation and case acceptance. And he always says, to have that sacred time with these patients where you're able to have these in-depth discussions and take those discussions as far as they need to go for however long was important. And that was a difficult decision to make because you could see all of these opportunities to fit an appointment in here and there, trim that new patient experience appointment or that new patient consultation appointment just a little bit so we could fit one more person in. Well, as your schedule gets more and more chaotic, the less you're going to be able to focus and spend time with that patient. And in the end, if comprehensive and restorative work is what you're wanting to do, that pays off in the end because you've spent valuable time with your valuable patients. So that's important. And, being able to overcome objections and that emotional flooding through active listening, as I said, when the patient is concerned about the money, to not be afraid of that conversation, but to speak to it and speak with them about it, to say questions like, so Carrie, it appears that the fees of concern to you. Yes, I don't know how I'm going to do that. I was supposed to get new tires on my car, next week, and this costs twice as much as that. So you have some other investments that you need to be making at the same time as this, and we need to figure out a way to help you take care of everything that you need to do. Would that be a safe assumption to make? Yes. And questions like that, to just keep talking about it. So tell me, what would be a comfortable amount that we could, if we were able to accomplish an arrangement in an amount that would be comfortable to you, what would that look like? And to have questions like that are just real conversations and giving that patient opportunities to think through it and talk about it. And to not be afraid of questions, concerns, or objections, because as long as they're having conversation with us, that's a gift. They're interested. When they say, I'll think about it, and they walk out the door, there's no more opportunity to help motivate them and help them understand the need for the treatment. They're gone at that point. So the longer we can help them answer the questions that they have, and the more prepared we are to talk about the objections that may come forward in those conversations, the better off we're going to be. And that's just practicing on each other. Get your team member that would be the best, pretend patient, and have them just hammer you with all of the typical objections or questions or issues or your own fears of questions that might come up, and role play together and practice those conversations until you feel comfortable talking in a professional way to those patients that may be asking those questions. You'll find that in those awkward role-playing, sometimes funny times, practicing together as a team, it puts you in a more prepared position when you are face-to-face with a patient that has those actual concerns.
Yeah.
So that's really, no, please go ahead.
Oh yeah, I was just going to say, it's not always that they can't afford it. They just have to figure out how. And you have to be there to acknowledge that and understand that and work with them through that. Because, like you said, they wouldn't be there, or they wouldn't be listening or entertaining it or asking questions if they weren't interested. Your team just has to be creative in ways to say, okay, let's figure out how to make this work. Now, what systems do you help with financing of? I mean, obviously there's certain lending institutions. Is there anything lately that you've come across that's great? I mean, I know there's Care Credit, but you've got to qualify for that. I mean, are there other programs out there, internal programs or external, that you would point people to?
For us, I feel like, to have your typical systems in place, where, what credit cards are you accepting? Do you give a reduction in fee if they pay in full up front? Care Credit is far and above, in my personal opinion, my preferred financial partner for practices. And the reason I say that is for a lot of things, but most importantly for the stability of that company. You want to be in partnership with financial companies that have been around the block. And Care Credit has been around for well over 20, 25 years, and doing great work for people. And they have a lot of resources on hand. They have a lot of team that's out there ready to help practices, execute their program more effectively. And I certainly would encourage practices that may be struggling with how to incorporate Care Credit more successfully, or may have some concerns or frustrations, that they reach out to these representatives to help them. And they have some great reporting tools now that can help you see the reality of patient financing in your practice. So that's far and above still my favorite. There are a lot of opportunities that are coming across for, in-office plans that in some states are acceptable. We think those are great if they're executed appropriately and consistently. But you do need to check with your state on if those are appropriate and what may be the regulations of having such a plan in place. So those can be helpful as well to keep patients that maybe don't have dental benefits and so on be able to receive the care that you're providing. But it's really a mix of having your systems managed well, having a variety of financial options in place, and then presenting those options to the patient and allowing them to make the decisions that are best for them. And to not be deterred when someone, maybe when there's a person that comes through and it was difficult, I think we often write off the process because the one time. But in our minds, we think, well, it's every time. Well, it was really the one time, and now you're afraid to take that on with another patient. And that's okay, but we need to understand these are opportunities to learn and refine and see how we can best provide this service to our patients. And, assuming on behalf of a patient is a disservice. So we want to make sure they know that they have all of these options on the table for them, and, what a difference that could make in helping them say yes to the treatment they either want and or need.
Yeah.
And that's, when you get to that,
you just never want to shut the door on a patient. They may come back, and
right.
you just, finding,
right.
Helping them realize options that maybe they hadn't thought about can be a good way. And like you said, it's not always about which system you're going with. Just make sure you have a system and you have it in place, and that you're offering it, and then listening to what's best for them.
Yeah, and your authenticity in the conversations, empathizing with them, but not sympathizing, and for them to know, we're here for you. Our intention is to help you get the best quality care you can possibly receive, and we want to make that a reality for you. How can we do this together? Let's work this out together so that you can get the kind of care you want. You came to this practice because you wanted the kind of care Dr. Gordon provides. Let's see what we can do together to make that a reality. And to feel comfortable in having those conversations and building confidence that that patient is somewhere safe, but somewhere where they are being heard and they are comfortable to speak up and ask questions, and that the team is for them and for their longevity of care. And that's what not only builds a satisfied patient, that builds a lifetime patient. And that builds the kind of raving fan patients that ultimately grow a practice, is when they have an experience that is above and beyond expectation, that is a place where they fully trust and engage with the doctor and the team. And then they want to spread the word and share their great experience with others. And that's where true foundational growth for a dental practice can take place.
I totally agree. So we've gone through the arrangement now. I think scheduling was last on your list. Tell me how that's effective and how that's ineffective, I guess. Give me your tips on that, because just getting the money commitment's one thing, and right. Talking about scheduling, where do we go from here?
Well, the scheduling conversation can go a couple of different ways, but I do want to make this one point is if your schedule is orchestrated in a way where you cannot see a patient in, the coming weeks, and you have a patient that's ready to move forward, you have a glitch. So how are you orchestrating your schedule so that you can see the kind of treatment you want to be providing more of, and make sure that you are planning appropriately and proactively in that approach? A lot of times you find if the patient doesn't schedule right off the bat, this is where I want to be really clear that we often stop the process after the presentation, just assuming if they didn't schedule, then we're just not, there's really not much in the plan ahead of how to stay in the forefront of that patient's mind and helping them make a decision. And the process doesn't stop when the patient leaves the practice. I want practices to start thinking about how do we carry the conversation forward, because our friends at Care Credit and Synchrony Financial did a study a couple of years ago, I think it was 2015, that says that patients now are taking upwards of 70 days to make a dental purchasing decision. So when you think about that, what are you doing in the next month or 2 months after you presented treatment to a patient to stay front of mind, to be available to answer any questions, to reach out to them to see if you can provide any further information or help them schedule that appointment? I think it's important to take that case presentation process, not just to the presentation itself, but what is your plan as a team to stay in conversation with them after the fact? And that's where your business team and your clinical team, everyone, it's all hands on deck, and all the different ways that they reach a patient become key, because our marketing team Our marketing advisors, teach from what's called the rule of 7, which is a marketing rule, not a Jameson rule, that says, and this is from the marketing world, that a person needs to see or feel or experience a message upwards of 7 times before they are motivated to act, before it resonates with them. So think about that. How many times have you touched that patient with the message of what's needed before it's going to resonate? So it's to not give up on that patient in that conversation. It's to stay consistent, stay persistent, and identify all the different ways that you can communicate and build relationship with your patients and stay in communication with them to find the way to yes that's best for them. And those are just some things to think about on that scheduling side, which kind of overlaps into your marketing and communications and how your patient communications are orchestrated and executed in your practice.
Well, I like it. There's a lot of in-depth material there that you could break. You could break all those categories even into subcategories even further and discuss. And I know, we're not going to cover all that in 1 hour, but, you did a pretty darn good job of walking through, how to make an efficient process, a profitable and consistent process there. It takes practice. It takes evaluation of what you're doing and what you want to be doing and refining your systems. Like you talked about, these are all systems. They take certain skills and the right people, and they take the right processes, and they take practice and all that. So, where can someone get more information from you? How can they, what kind of services can you provide to help someone say, hey, I'm ready to go to the next level. I think we're getting these patients in. It's just not, I need to do more. I just don't know how to. Maybe these concepts are new, or those positions are new and they don't know how to implement them. I assume that's where you come in and say, look, we can help you put in the protocols and systems and walk you through it. So how does that work for somebody? Obviously, there's marketing, there's coaching. What all do you offer, and where's a good place to start?
Yeah, well, you're right, and thanks for asking, because what we're talking about here, if that's not the reality for you now, I mean, it can be very overwhelming to think about, oh, wow, all this work that needs to be done. It does take a lot of sweat equity. But there are more effective paths to get to that end result that you're looking for. And we certainly have worked with many clients over the years in helping them streamline their case presentation skills and processes and be more effective and more successful in their approach in building those patient relationships and getting that case acceptance. We do in-office coaching for dentists and teams on location in their practices, and we also do full-service marketing if getting that material more concise and clear and really helping to get the message out about your practice to your community is a need as well. So the best way forward is to reach out to us at our website, jamesonmanagement.com, JAMESON, management, all spelled out. Or you can call us at 877-369-5558. Or just email me, Carrie at jamesonmanagement.com, and I'll connect you with my team. We do complimentary discovery calls where we want to learn about you and your practice vision, what's going on, what you feel are your strongest needs, and try to discover a way forward that we can utilize the tools we have available to help you accomplish your goals and vision for your practice. So jamesonmanagement.com is a great place to find us. You can also find us on Facebook and Twitter, or just give us a call or email me directly, and I would be honored and happy to connect you with my team.
I know you've got a lot of years of experience, and you guys have a great reputation. I think even if somebody doesn't know what they don't know, they should just give you a call and figure out, where they're at in the process, what you offer, and if it's right for them. Because I think a lot of people think, we're doing okay, or, why do I need a consultant? But I think it's been proven that, even people that have success, need mentors and coaches. They need people to challenge them. They need accountability, and really, sometimes you have to look outward for those things. So I definitely encourage, people to look into your services and your products, and at least explore what they don't know. And that's sometimes the first step of learning.
Well, thank you. I appreciate those words so much. And that is definitely what the heart of what we do is. And we would be happy to have that introductory conversation with anyone. And, no strings attached. It really is just a conversation to uncover top opportunities for doctors and where they are in their journey. And we just want to help people have healthy, happy lives, whatever that looks like for them. So I appreciate your encouragement of that journey as well, Dr. Gordon, and really appreciate being on your podcast. You were doing the same thing through this outlet, and I am really grateful to be a part of it. So thank you for inviting me.
Absolutely. It's been a pleasure to have you.